And my title is that I'm from Alberta Health Services. I'm the Senior Medical Director of the Neuroscience, Rehabilitation, and Vision Strategic Clinical Network.
Dr. Ho, I'm hoping just to start, you can walk me back to maybe this time last year, or maybe a little bit earlier in last year, when we're starting to see patients with COVID that's lasting longer than expected, that's now called long COVID. What was that like for you in your role, seeing that and needing to develop these new clinics and study what's happening?
Yeah, Carly, that's a really important question, because when this time last year, right, when we started to see that from other countries that have gone through COVID a bit earlier than Canada, and they were reporting that people were experiencing long-term symptoms, we were very concerned, because at one time, right, we thought that, okay, people got COVID and then they'll just recover and be better. But no, a significant number of individuals would actually have long-term symptoms. So that's really concerning. And that's why within AHS, we started to think about, okay, how can we support Albertans with these long-term symptoms? Because even though we were a few months like later than the other countries, we know that our projection would be, our trajectory would be quite similar, right? And so other countries had started to provide support and to plan for the Post COVID Syndrome management. And we felt that we need to do the same here in Alberta. And that's why we started our journey within AHS to plan for the support of people with post-COVID problems. And what we did was that we actually got together our stakeholders from across the province, from all 5 zones, from North Zone to Edmonton Zone, Central Zone, Calgary Zone, and South Zone. And we came together and really understand what the problems may be. We engaged our patient partners so that they would tell us what symptoms and what problems they were experiencing. And then we started to design pathways and also support systems so that we can support them better. And so about a year later now, we have multiple resources and also support programs that we can use to support Albertans with post-COVID problems.
Can you walk me through some of the symptoms of long COVID? I know it's different from patient to patient.
Yes.
And at what point in the timeline is it considered long COVID?
And that's another important question too, because there is still yet an internationally agreed definition of long COVID or post-COVID conditions. And basically we are recognizing that people may develop these symptoms weeks after their initial diagnosis, or it could be months. So it is actually quite different. And some people may just have these symptoms lasting for many more weeks, and some may last for many more months. So it's really variable. Having said all of that, the multiple research papers that came out from other countries all point towards the fact that the following symptoms are the commonest, and they are things like profound fatigue and post-exertion malaise, and also cognitive problems like brain fog, like you can't think properly, and also shortness of breath and pain as well. These are some of the commonest problems. Not to say that people may not be experiencing other symptoms too, right? But those are the commonest ones that we see from the different reports from other countries.
So really, you were still learning to understand what's
Yes.
happening, and then trying to also support these patients and learn ways to treat them. What's some of the treatments that you figured out over time that may work for some patients?
So what we understand is that some of these conditions actually may need further medical workup and medical diagnosis. And now we have these specialized clinics that can help to achieve that in Calgary and Edmonton. And in Edmonton is at the K Edmonton Clinic. And the pulmonary clinic there has done a great job to support this population. And then in Calgary, at the Peter Lougheed Center and also at the Rocky View General Hospital, they have also got clinics to support the further workup and diagnosis of these patients. Now, some of these patients may need further medical treatments, but some of them may require rehabilitation to support the management of these symptoms, right? For instance, if we talk about things like profound fatigue or post-exertion malaise, right now, there's no clear medical treatment that we use for these conditions. But at the same time, we know that rehabilitation techniques can support these individuals to feel better. And so we are using a number of things, including medical as well as rehabilitation treatments to help support people so that they can be more functional and be better adjusted to their problems.
Mm-hmm. What do we know in terms of numbers? I know this is a hard thing to track. Do we have numbers for Alberta, and is there a estimate from the research that we're seeing worldwide?
Sure. In Alberta, we don't have the actual number yet. However, what we are doing is the following. First of all, we are looking at the research from other countries to see what percentage of their patients with COVID diagnosis would develop post-COVID or long-COVID symptoms. And so the numbers actually vary a lot from 10% in some reports to all the way like above 50% or more. So what we are doing right now is that we're using a conservative estimate of about 20%. And so right now, right, this week, we know that there are over 270,000 Albertans with a COVID diagnosis. And if you take 20%, then we are looking at over 48,000 people. That's our estimate, right? Now, some people may have fully recovered by now, but some people may still have ongoing symptoms, so we don't know that. So in order for us to really fully understand that, we will be embarking on a big survey that actually will be sent out to a large number of Albertans who had the COVID testing done since March of 2020. The survey will be very comprehensive and will actually be based on international surveys that have been used elsewhere. And then basically that will help us understand what percentage of Albertans with COVID have what symptoms and for what duration. So that's going to give us a lot of very good information, and also information that can go back to the clinics and go back to Albertans with COVID, so that we all will have a lot better understanding as to how this works. It really is a matter of trying to support Albertans now, as well as trying to learn more about it.
Mm-hmm. And when we hear that large number of people expected to have this post-COVID syndrome, what's being done to prepare family doctors who have patients coming in who might not even realize that this is related to their COVID diagnosis?
Yes, and that's a very important point, because the symptoms can be so vague, right? And so vague and non-specific that people may not recognize them. And they may just think, why am I feeling this way? Or the doctors may think, what is going on there? Because they just cannot find anything wrong. And so what we're doing are the following. We are trying to provide a lot of information to our providers and to our public. And we're doing this through a lot of online resources. We have established a large number of resources that are downloadable from the AHS website. And also we have been doing webinars to different providers. And we have also been trying to create other resources, such as the support for the establishment of the rehabilitation advice line under HealthLink. And so people can just be calling the rehab advice line to learn more about this and to actually be directed to the right support. And so we have, a multi-pronged approach, right? Online, telephone, and also some um, uh, um, materials that we are disseminating, as well as these actual clinics. And we are also building the community rehabilitation resources too, because we recognize that most of these individuals will be living in the community and not in the hospital, right? And so having that community capacity and resources will be a top priority.
Mm-hmm. I'm wondering if you know, in Alberta, what's the longest long COVID case we have so far? Do you have those details?
We don't actually have this information, and I'm hoping that with our survey, we will be gaining that information. The survey is not out yet. The survey, we're hoping that it will be out sometime maybe in September, thereabouts. And so what I'm trying to ask people to do is that if you get the survey, the invitation to participate in the survey, please complete it, because it will be very helpful, not just to the health services, it'll be helpful to other Albertans with this condition to understand better what they are experiencing. And also the information will go back to their family doctors and to other frontline people, so that we know how best to support them. So it's very important that we support this survey.
Mm-hmm. Are there any details out about how the vaccine impacts long COVID, or is it still too early for that information?
It is still early. I think that there have been several reports about it, but we need a lot more data to understand that better.
Definitely, for sure. Is there anything else we missed on that you want Albertans to hear when we're talking about this post-COVID syndrome, and about this survey, and about the supports that are out there?
Yes, I think that, the post-COVID syndrome is something that people may experience after COVID, but it is not just for people who were very sick, who went to the hospital. Even people who were initially not very sick, who did not even require hospitalization, may experience or may develop post-COVID symptoms. And so that's really important to know. And so the best way to prevent it is to not catch COVID, right? And to get the vaccine. So, I think those are the key messages.
Mm-hmm, definitely. And it's still fairly unknown why some people have long COVID and some don't. Is that correct?
That's right. We are still learning about that.